If you've ever dismissed a migraine as just a bad headache, well, we're here to set the record straight. We've pulled together the latest insights from neurologists all over the world, from Australia to the Cleveland Clinic, to give you a really clear look at what a migraine actually is, what's causing it, and most importantly, the new and better ways to manage it.
So here's our game plan. We're going to start by really understanding what a migraine is, then dive into the causes. After that, we'll get right into the practical stuff: how to get immediate relief, how to prevent attacks in the long run, and finally, we'll look at some game-changing new treatments. So let's jump in.
Okay, first things first. Let's get this one thing crystal clear. A migraine is so much more than just a bad headache. We're talking about a complex and honestly often debilitating neurological disorder, and its impact is absolutely staggering. Just think about this for a second. According to the Global Burden of Disease Study, migraine is the #1 cause of disability for people under the age of 50. That's huge. This isn't just an inconvenience. It's something that literally takes people out of their work, away from their families, and puts their lives on hold.
You see, a migraine isn't a single symptom, it's a whole collection of them. That severe one-sided throbbing pain is what everyone knows, but it usually comes with this intense sensitivity to light and sound, and nausea that can make even moving your head feel like an impossible task.
So what in the world is going on inside the brain to cause all of this? Let's peel back the layers and look at the biological chain reaction that experts have now mapped out.
The best way to think about a migraine attack is like a biological domino effect. It all starts when some brain cells get a little, hyperactive and send out these alarm signals. This in turn activates a major nerve in your face called the trigeminal nerve, which then releases a key chemical messenger called CGRP. And CGRP is the real troublemaker here. It causes blood vessels in the brain to swell up and get inflamed, and boom, that's where that intense throbbing pain comes from.
Now, here's the interesting part. While that whole process inside the brain is biological, it's often set off by stuff in our everyday lives. A whole host of things can tip those first dominoes. Things like stress, not getting enough sleep, being dehydrated, or even certain foods and strong smells.
All right, so you feel that all too familiar twinge of an attack starting. What do the experts say is the best way to stop it dead in its tracks? How do you get that immediate relief?
The advice from every expert is unanimous and simple. Treat it early. You have to think of it like stopping those dominoes right after the first one falls. The medications that abort an attack work best right at the very beginning. If you wait, that whole inflammatory cascade just builds up steam, and it becomes way harder to get under control.
Now, for that immediate relief, doctors typically reach for two main types of medicine. For milder attacks, sometimes over-the-counter stuff like ibuprofen or naproxen can do the trick. But for those moderate to severe attacks, they often go to a class of drugs called triptans. These are different. They're specifically designed to target and shut down a migraine process right in the brain. And this really highlights a super important point from neurologists like Dr. Bronwyn Jenkins. Finding the right medication is a personal journey. You know, what works wonders for one person might not do a thing for someone else. It often takes a bit of trial and error, working with your doctor, to find the triptan that gives you the most relief with the fewest side effects.
Stopping an attack once it starts is crucial, but let's be honest, the real holy grail is to have fewer of them in the first place. So let's shift gears and talk about long-term prevention strategies.
You know, it's interesting. Doctors all over the world emphasize that the foundation of prevention isn't actually a pill, it's your lifestyle. The really powerful first-line defense comes from simple things: staying hydrated, keeping a regular sleep schedule, getting some consistent exercise, and finding ways to manage stress. These are the fundamentals.
But what about when those lifestyle changes just aren't cutting it? Well, that's when doctors might bring up preventative medication, or what they call prophylaxis. They usually consider this for people who are having 3 or more really severe migraine days a month, or when the attacks are just becoming too difficult to manage with acute treatments alone.
What's really fascinating here is that most of the traditional daily preventative meds weren't even made for migraine. They're actually drugs for things like high blood pressure, depression, or epilepsy. Researchers discovered, often kind of by accident, that these medications also happen to help regulate the brain's chemistry in a way that makes it less prone to migraine attacks.
Okay, this brings us to the most exciting part of this whole discussion, the cutting-edge stuff. We're seeing new, incredibly targeted treatments that are completely changing the game for so many people living with migraine. For people with chronic migraine,
and that's defined as 15 or more headache days a month, who haven't had luck with oral meds, Botox has become a really important option. And no, this isn't for wrinkles. A neurologist gives 31 tiny targeted injections around the head and neck every 3 months, and it's thought to work by blocking those pain signals from ever being released.
But the biggest breakthrough, by far, has been a new class of drugs that directly target CGRP. Remember, that's the key chemical in the whole migraine domino effect. These are amazing because they are the first drugs ever designed from the ground up specifically to prevent migraines. Most are a simple monthly injection you can do at home, and there's even an oral option now too.
But here's where it gets really interesting. What if one of these incredible new treatments still isn't quite enough? Well, a study from the Cleveland Clinic looked at exactly that. They took patients who weren't getting the relief they needed from either Botox or a CGRP inhibitor alone, and they decided to try giving them both at the same time.
And the results? It was pretty remarkable. The patients on this dual therapy had a 50% greater reduction in their monthly migraine days compared to when they were just on one. This is a huge deal. It suggests that for the most difficult to treat cases of chronic migraine, combining these therapies could be a powerful new strategy.
Okay, so we've covered a ton of ground. Let's boil it all down. What are the most important things to walk away with?
It really all comes down to having a smart, personalized management plan. Step 1. Recognize this for what it is, a real, complex neurological disease. Step 2. Be proactive. Treat attacks the moment they start, but put your real focus on prevention, starting with lifestyle. And finally, work with your doctor to find what's right for you. And always remember that with these new targeted therapies, there is more hope than ever before.
So, in the end, it all leads to this one central question. Understanding all these options is a fantastic first step, but the next, and honestly the most important one, is taking this knowledge and having a conversation with your doctor to build that personalized plan that is truly right for you.